Hi, welcome back. And we are now into module 4, which is the lactation postpartum. So, congratulations. You now are working with babies and families as well. And this is an exciting time. And also, the obviously the biggest goal here is to understand why breastfeeding is so very important to both baby and mom, and that it has advantages for both. Realize that prenatal supplements and a healthy diet are still very, very important, and they're going to contribute to mom's recovery, and they're going to support successful lactation. Reinforcing hydration during lactation and local resources that support successful breastfeeding. And hopefully, this time we'll do create a smoothie activity that they can taste and participants can try at home, since it's going to be really important to keep up the nutrition during this really busy time. So for this class, hopefully, your participants will bring the baby. And this is always really, really exciting to meet, after going through the whole pregnancy and maybe even the pre-pregnancy period, to be able to share about the baby. And moms may, be breastfeeding in your class, which is great too. We're going to talk about prior changes, maybe go over the meal prepping and how that's working out, because, if they've learned to do some planning with meals, that's really going to help their growing family too. And this is a time of life where it feels a little bit upside down. Um, there's not a lot of sleeping going on, and life, it's just a major life change. So any way you can support any action that they've taken, small steps, that will be good to do that reinforcement and answer questions. This time on their note card, you're going to ask them their impression of how infant feeding is progressing, their favorite calcium-rich food. It's important for calcium now to protect the mom's bones. So what's interesting is the calcium in breast milk tends to be pretty consistent, even with a low calcium diet. But what's happening is it will be drawn from mom's bones, which can impact her skeleton and her future pregnancies. So we're going to really focus on calcium and any questions they may have about the postpartum period. So moms might want to know about their own personal health, weight, have a lot of questions about food and nutrition and breastfeeding. So encourage them to write that down and share with the other participants if they feel comfortable. And reinforce the continued need, again, to eat the whole foods, nutrient-rich diet, take their daily prenatal supplements, and participate in regular, gentle exercise. So the benefits for both baby and mom, um, receiving breast milk, even for 3 months, is going to confer advantages that will last throughout the baby's whole lifetime. The bacteria present in mom's milk contributes to a healthy microbiome in the baby. There's both the bacteria in the milk and even some of the bacteria on mom's skin that the baby will receive. So we don't often think of that, but that's why it's not even recommended, like, to wash the nipples or sterilize your nipples before breastfeeding, because there's often beneficial bacteria on the skin as well as the bacteria in the breast milk. And if the mom is eating a diet rich in vegetables, fruits, whole grains, and fermented foods, she will have a healthy microbiome. This will be reflected in the breast milk she's producing. The seafood, which is rich in DHA, will promote healthy brain and visual development. Not every nutrient that you take in goes to the breast milk. A notable example is vitamin D. That's why babies who are breastfed are often given vitamin D drops. But and iron, there's not much you can do to increase iron. Breast milk is not a high iron food, but babies are born with iron stores that will last them a good 6 months until they start eating solids. But some nutrients, such as fat, and that includes DHA, does get transferred to the breast milk. So the more DHA that mom gets through seafood and supplements, the higher the level in the breast milk. And that, again, promotes healthy brain and visual development in the baby. So, in terms of the baby, this comes straight from the American Academy of Pediatrics. That it's a long list, but in their position paper, their policy statement for breastfeeding, babies that receive breast milk have fewer ear infections, less diarrhea, fewer respiratory illnesses. The risk of sudden infant death syndrome is reduced, inflammatory bowel disease, even cancer such as leukemia, diabetes, obesity, asthma, atopic dermatitis, which is like a skin rash. All of these things occur less frequently among children who are breastfed as infants. And mothers who breastfeed, here's the good news, have a lowered lifetime risk of type 2 diabetes, cancers such as breast, ovarian, and endometrial, and high blood pressure. So it's pretty amazing that, I mean, if we had a pill that could do all this, everybody would want to take it. But these are some of the advantages of breastfeeding for both mom and baby. So quite important. There is a handout, Eating Well While Nursing, and I would review that with a participant and discuss any questions. The handout addresses returning to pre-pregnancy weight and fitness. Yes, women who are breastfeeding can lose weight. It is important that they do it gradually and still are eating enough to support a healthy milk supply. The well-balanced diet as a part of the postpartum. We often call this period the fourth trimester. And, that's why healthy food and, avoiding substance abuse and all those types of things continue to be just as if you were pregnant, and taking your prenatal supplements, increasing and recognizing there's a real increased need for hydration. What's interesting about this so-called fourth trimester or postpartum period is if you are full-time breastfeeding, your caloric need is actually higher than when you were pregnant. You're actually using more calories to produce the breast milk for your baby than you were during pregnancy. So it's pretty amazing. As breastfeeding progresses, you sometimes, like a 3 or 4 month old infant who is being exclusively breastfed, can the mom that's feeding them would use up 600 to 800 calories a day in supplying the complete needs of a 3 or 4 month old baby. So it is significant how much, and that's why it's okay to lose weight, but gradually, because you also have this energy need to produce this milk. Breastfeeding, I think I mentioned before in an earlier module, it might be natural, but it doesn't always mean it's easy. It can pose challenges, especially for the first time mom. And it doesn't matter if you've taken classes or you're highly educated. Um, it's just something that is a skill that you and the baby together are learning, and there can be challenges. That's why we have these wonderful people called lactation consultants. And it's important that you, if you're going to support successful breastfeeding, that you do discuss local resources available in your community. So it might be hospital based or birthing centers or private lactation consultants. Sometimes pediatricians are partnered with lactation support and consultants. But whatever it is in your community, make sure that women have access and that they have access early, because sometimes it's in the first couple weeks that the frustrations will sometimes lead to moms abandoning breastfeeding. So, if you can, I really recommend inviting a local lactation consultant to this session to provide information and address questions and concerns. When I've taught classes such as this in the past, I always try to invite a local lactation consultant. Um, I can talk about the importance of nutrition and milk supply and all the reasons we want to do it and healthy eating and drinking. But a lactation consultant can talk about the very practical matters of positioning and latching and milk supply. And what do you do if you're engorged? And what do you do if your milk supply is low? And, sometimes simply the right position and teaching moms how to recognize, proper latching can really help and can really go a long way. So, I just want to really encourage that if we're going to support breastfeeding, we need to kind of do the nuts and bolts of it too, not just telling moms it's good to do. For general information about breastfeeding, there's a helpful link here on the womenshealth.gov site. And also, there are times when exclusive or even partial breastfeeding is not feasible. There can just be, it could be a medication or a medical issue. It could be a supply issue. There's all kinds of things. Sometimes returning to work and not being able to pump. Um, Whatever. It's important to support the decision and offer guidance too on selecting, mixing, and storing standard infant formulas. Also reassuring that infant formula is the closest and best thing we have to breastfeeding. And over the years, infant formula has very much improved too. For instance, most of them have DHA and they closely match the composition of breast milk. They're not breast milk, but they're a very, very good alternative. So we don't want moms to feel bad and families to feel, that they're not providing the best for their babies. So it's very important that we avoid that judgment. Support, but not judgment. Oh, whoops. Okay. Sorry. So during breastfeeding, calcium and vitamin D are especially important for mom. As I mentioned before, the composition of breast milk is going to be about the same, and it's going to have all the calcium needed for your growing baby. The problem is that it will draw from your skeleton and impact your skeletal health and also your future pregnancies. So it is important to get enough calcium to support your own skeleton. Um, Vitamin D is often recommended in Oregon or the Pacific Northwest, and it's normally included in the prenatal supplement. So your needs are covered. And most pediatric providers recommend a daily vitamin D drop of about 400 units for breastfed infants. So that's standard practice. Um, but calcium is really important, and you want to get at least your 1,000 milligrams of calcium. I've included a couple recipes that are going to promote that, including the smoothie and a vegetable lasagna that has 500 milligrams, or half your calcium need for one serving. If you have time, this is a really fun activity to do, the Create a Smoothie. And again, it's a flexible recipe where you can use a variety of different fruits, vegetables, things like avocado, spinach, and the participants can make it a variety of different ways. It will provide hydration, and it will also provide calcium and nutrients, and it's very flexible. It could even be a simple meal replacement, and it's easy to drink a smoothie while you're breastfeeding. So I would hand out an additional sheet of paper or use the back of the handout and ask participants to come up with 3 possible combinations for smoothies. If they don't have a blender, some of them can even be, used with a whisk or shaken, depending on the fruits and vegetables and things that they decide to use. So I would demonstrate that and share samples, and that's a great way to engage your participants. So in terms of bringing about change, again, are there questions? Use the 1 to 10 motivation scale. Ask them to turn over their note cards and, come up with an action plan. Encourage group discussion. And I think you're going to get a lot of group discussion in this session because, we have the babies. Many of the participants will be lactating, and they'll be sharing tips and experiences and frustrations. So I would allow for extra time even for them to kind of, share and support among each other. They may even want to share information to take it offline. I've had that happen a lot of times too, where they, you could pass around a sheet of paper if they want to, have each other's emails or cell phones to, continue to be a source of support. And then finally, an example, so maybe they really are thinking about DHA and their infant's brain development, and they want to add more DHA sources. But seafood, maybe a barrier is their family doesn't like seafood, they can't afford it, it's difficult to prepare. And talking about how they might want to purchase canned salmon or chunk light tuna, and also look for recipes on the My Plate recipe page. I looked on there and there's 54 seafood recipes, and ask family or friends for help with shopping and preparation. Sometimes if the family doesn't like seafood, that's why having like the canned salmon or tuna that they could make for their lunch, add to a salad, or make an easy, salmon or tuna salad recipe, so that it's not something that the whole family is forced to eat, or just using creative other recipes in order to do that. Also, considering the other sources, so flaxseed and walnuts, and vegetarian type DHA supplements, the algae based, are good suggestions. So thank you. And I hope that you find this curriculum helpful and you're able to adapt it for your particular setting and clients and patients, and that you find a lot of success with this.